All right, I'm gonna share my slide now. All right, so if anybody can't see my screen, write in the chat. Any technical error, if you can't hear my voice, if you can't see properly, if the slide is not visible, just write in the chat and we're gonna make sure we address that. So today we're gonna start with learn to stretch like a pro. I will try to make sure like I cover every possible stretching concept. So all the science of stretch, so you can do it yourself and you will understand like the passive versus stretch, like going out, like passive versus active stretching. So these are the topics we're going to cover today. Different types of stretching. There are so many different types of stretching. How long you need to hold it, because that's the one of the question that I hear a lot. Should I hold it 10 seconds, 30 seconds, 60 seconds? I'll go into that one. Self-check for flexibility and muscle length. How do you know you're tight? Some of the muscles are tight, some of the muscles are not tight. So how do you know which muscles you need to stretch regularly, which muscles you need to stretch longer than normal, or which muscle you just need to do maintenance? So I'm gonna try to pick some of the very specific muscles, those are normally gets tight. So I'll explain that, how you can check it yourself. The common mistakes during the stretching that most of the time people compensate or they overstretch. So I'll go over that one. The benefits of stretching, we'll cover that. The don'ts for stretching, that what you should not do. Okay, and then we're gonna do the follow along desk stretches. There are specific stretching based on the muscle. I decided like which one we're gonna do it, and also the full body stretching. So along with the desk stretching, we're gonna not the like all the muscles, but we're gonna cover the majority of the important muscles that we need to stretch. Okay, and we're gonna do the passive stretching demonstration. That means that what is the passive, like once you understand the types of stretching and what is the active versus passive, I'm gonna show you some demo for passive stretching as well. All right, so let's get into it, and let's start with the benefits of the stretching. Mainly there are 4 benefits that you can get. There are more benefits, but main 4 benefits are: you increase your range of motion. Any movement you do, any activity you do, any daily work you do, you need your range of motion. Most of the time people get injured when their range of motion is limited, because let's say your shoulder is only going this way, and or let's say going this way because your pectoral is just tight and you cannot go back, and you're playing tennis, okay, or badminton or any sports, and all of a sudden you're doing quick stretch all the way on the back, but your muscles are tight. What it will do, it will pull your joint. So that affects the joint, that affects the injury, that can increase your risk of injury. It prevents the aches and pains. So when you stretch your muscle, it calms the muscle down. When it calms down the muscle, it takes the pressure off from your joint, and then it allows your joint to move freely, reduce the aches and pains. And then, as I explained about the shoulder, that it does reduce the risk of injury, especially people who require repetitive movement, like pushing, pulling, somebody working in the warehouse where they had to lift repeatedly some boxes, or like, their job required constant sitting on the computer, which is very common, right? So those are the things that regular stretching helps with. Stretching also relaxing and release your stress. How many of you feel when you're working on the computer, or when you're sitting, or when you're just browsing on the phone, and at the end of the day, evening, nighttime, you feel like, I'm just like, how many of like you do like this, or just like, press your trapezius, or you feel like, okay, if I can get the massage therapist every day at my home in the evening, I'll be good. So that because you're lacking the regular stretching. All right. So for good. And as I said, any question, just write in the chat. I'll address it, promise. So there are different types of stretching, okay? But I'll categorize mainly 4 types, because there are different names of different subtype of the stretching on all those main category. But I'm gonna explain that active stretching, passive stretching, dynamic stretching, and PNF stretching, okay? So let's go one by one, that what is active stretching, what is passive, what is dynamic, and what is PNF. So the active and passive stretching. So Active stretching is basically you're using your own muscles to move your joint to stretch your muscles. That does not require any external force. So for example, when I'm doing this, okay, I'm stretching my trapezius here. That's the active stretch. Means I'm not using any external force. Versus passive, I use my hand and I pull more. So I'm using the external force like this to stretch more. So that's the passive stretching. It could be you doing your own thing, or use your belt or something like that, or somebody else is pushing it. So that's the passive stretching. Usually passive stretching is a little bit intense than the active stretching. Active stretching, you have a limitation because whatever the length you have in your muscles, you won't be able to push a little bit further than that. You see better results in passive stretching, but the active stretching is also good as well. Now, dynamic stretching is a little bit different. The dynamic stretching is mainly used in the warm-up. So let's say how many times, like you must have, if you have played any sports or if you watch any sports, before they do any kind of like an activity, they do like, okay, just circle the hand, or like, just move your hands like this, or move your leg up and down. So that's the dynamic stretching. So simple example is you're standing, you stand up and you just swing your leg forward and backward, okay, or side to side, okay. Other example is the arm circle, hip circles, walking lunges, but those are mainly used in the warm-up. So let's say you're going for a run, okay. You wanted to do a little bit dynamic stretching. You want to make sure your hip is moving, make sure your knees are like warmed up, make sure your ankle, you're just making a circle on the ankle. So that helps to prevent the injury. They're preparing your joint and muscles for the aggressive activities. Now, this is my favorite, the PNF stretching. The reason that it's my favorite is because you see the results right away. You see really good outcome by performing the PNF stretching. Now in PNF stretching, there are different types as well, but one simple type is a contract relax. So the simple way I can say, let's say, again, I'm going to give you example of the triceps. So in here, there are 3 steps. You stretch the muscles, okay? So I'm stretching it here, and then you ask the person to contract. So now I'm going to ask person to contract that muscle. So they're giving a resistance against, like they're pushing against my resistance. And then after holding about 10 seconds, we ask the person to relax the muscles. And then we check whatever the new range we gained, we go further and repeat the process. Okay, so that's the PNF. That's one of the type of the PNF stretching. There are different types in that one as well, but this one is a very common one. But you see the results much better than active and passive stretching. All right, now the question, most important question is, how long should I hold the stretch? Now, of course, like 10 seconds, 30 seconds, 60 seconds, even 2 minutes, there are different significance of hold. When you're stretching your muscles only in 10 seconds, so basically that brief stretch helps with the blood flow, prepare your muscles for more intense stretching. So you're just preparing. So like, anytime like, you're doing the warm up, yes, you can include this one as well. So along with like, increasing your heart rate, you can work like a little bit like, gentle stretch, that just preparing your muscles. You don't want to do a long hold before the workout because you want your muscles to be a little bit tight. If it's too relaxed, that increases the risk of like injury. So before the workout, you don't want to hold it too long. You can just hold maybe 10 seconds and just increase your blood flow. Okay. So as I mentioned, it's suitable for warm-ups, throughout the day routine stretching, alleviate the muscle tightness on routine. Now, 30 seconds is most of the time people practice this. The sufficient to relax the muscle and improve the flexibility and range of motion over the time. One of the statistics that I read, if you stretch your muscle every day, okay, regularly, religiously, you're stretching your muscles, you're holding it 30 seconds, 30 seconds or more. In a month, you can lengthen the muscle by 1 centimeter. So I think like, I read like some of the article and I came across this statement, which really fascinating because after stretching every day, you can lengthen by 1 centimeter. So you can think about it. You don't stretch like a couple of times a week and expect, okay, yes, now I'm good. My hamstrings are like not tight anymore and my pectoralis are good and I should expect the result. No, the consistency is the key. You got to make sure you keep on stretching your muscles. You got to make sure, like, that you're consistent about it. You got to make sure you do it right and you hold for long enough time that you can see some physiological changes in your muscles. Okay. All right. Now, 60-second or more now, or more, I'll say. You can go up to like yoga. So there are many poses that you can hold for a long period of time. They say normal breathing, just deep breathing, and you hold it as long as you can. Longer you hold, better your poses. Okay. Many yoga poses are the stretch. Okay. And we'll go over like some of the poses as well. But longer you hold, better your muscles will get adapted. Okay. So it provides the deep stretching that promotes full relaxation and reduce the tension. Stimulate the adaptation within the muscle, which promote tissue length and elasticity and flexibility. It's suitable for people who are looking for significant improvement in targeted area. So if someone comes with a really tight hamstring or really tight hip flexors, we want to make sure we hold it more than 60 seconds. So that really can change in physiological, like, the state of the muscles, and that can really help long term. Now, one of the technical term I'm going to explain here, when you stretch your muscle, you're activating your stretch reflex. Okay. When you activate your stretch reflex, that means muscle wants to go back to the normal state. You're pulling it like a rubber. When you pull the rubber, they want to go back to the normal position. So same with the muscle. When you pull it, they wanted to go back to the normal state of, like, normal muscle length. But if you hold long enough, especially more than 25 to 30 seconds, anything more than 30 seconds, I would say, after 30 seconds, your muscle, the stretch reflex diminished, it gives up. And basically you're activating Golgi tendon. That is one small thing in your muscle fiber that get activated. What it does, it adapts your muscle with the new length. So if you're holding 10 seconds with the hope that I'm just doing the stretching and I should be able to see the results and I should be able to get better with my hamstring or my trapezius or my pectoralis, not going to help. Okay. You need to hold long enough to see some physiological changes. So I hope you understand that, how long you need to hold. Every holding time has the meaning. All right. So we're going to do some tests, and this will tell you whether these muscles are tight or not. Now, I try to explain a little bit, like, these muscles, the hamstring, Thomas test is for your hip flexors, the pectoralis major and minor tightness, and the side bending, which is your QL, which is quadratus lumborum. So how do you test, like, if you're tight or not? So here, I'm going to have Amalia, which is our therapist, and we're going to demo the hamstring, Thomas, pectoralis, and side bending. All right, so let me make the full screen so you can see it. All right. Okay, I'm gonna stop the recording. I'm sorry, the share screen so you can see my full screen. All right. So let's start with, so this is Amalia. Okay. All right. So the first thing we're gonna do is the 1990 hamstring 1990. Okay. So the reason it's called 1990 is because you're getting 90 degree in your knee, 90 degree in your hip. Okay. So it's like a tabletop position. You're trying to extend your knee. Okay. And then we measure the angle. You don't need to measure with the goniometer. You can just kind of guess. But when I do this, and then I'm going to take it down and let's see. So I see about 24 degree. So when I see that 24 degree, that means her hamstrings are tight. Anything less than 20 degree is okay. But when anything more than 20 degree, that means her hamstrings are very tight, and that can affect her back pain, or that can affect the hip, that can affect the gait. When you're young like Amalia, you're good. But as you start getting like a little bit older, like me, 40 or over, you start seeing the result, like start seeing like, okay, the tightness is affecting me and like that. So that's the hamstring. That's how you check your hamstring length. Then we're gonna check your Thomas test. That before that, I'm gonna show you the QL stretch, because let's see how you can check it. So I don't need to change the angle, because for the Thomas test, I need to change the angle. So let's stand up. So to check your QL, which is your quadratus lumborum, which is one of the muscle goes from your lower rib, the last rib, to your hip bone, which affects the stiffness in your back. So you stand up, and simple way is you go sideways. Okay, just go down and don't compensate, like don't turn your back, don't twist it. It has to be straight, and go down and see where your fingertips are reaching. Okay, so if you're crossing your knee, you're good. But if you're halfway around the thigh, okay, that means your QL on the other side is tight. Okay, all right. Now I'm going to show you the Thomas test. So for that, you're going to be on the edge of the bed, okay, and then you bend your one leg, okay, up, and see this leg relax, and this leg stays down. That means she does not have a hip tight hip flexors. But if the leg stays up like this a little bit, that means her hip flexors are tight. Okay, all right, we're gonna scoot up. Now, the significance of that, when your hamstrings are tight, it pulls your back like this. Okay, and when your hip flexors are tight, it tilts your pelvic forward. That increases your lumbar curvature. When your hamstrings are tight, it flattens your back. So if somebody has the back pain, you wanted to check your hamstring and hip flexors, because that can really help you to alleviate the pain from your back, because you want to align your pelvic. All right, we're going to check your pectoralis major. It's a simple test that you can do. Okay, keep your hands on the head. Okay, I'm going to take the pillow off, and then push your hands down. Okay, so if you can touch on the down on the table, good. But if you have a tight, yep, you won't be able to, like, your hands will be up in the air. That means your pectoralis is tight. Okay, all right. And that's the way you can find out. And there are a little bit more different muscles as well that you can check as well. All right. Okay, thank you, Amalia. I'll call you when we need to do more stretching. Okay. All right, let me share the screen again. So now you know how to check your flexibility. Okay, and this, as I said, these are the basic ones. There are different muscles that we can check it as well. Now, the common mistakes during the stretching. So the biggest mistake that I see is the hamstrings, like compensation. So when you're stretching your hamstring, so for example, when someone is stretching the hamstring, let's say if I'm doing this, okay, they keep this bend like this. When you do this, you're not getting a good stretch, because you can go further, but you're not stretching really your hamstring. Okay, so you need to make sure this is stabilized, and then you stretch your hamstring. Okay, same thing happens with the neck stretch. When I'm stretching my neck like this, what I will do is I'll move my whole upper back like this. Okay, so I'm compensating. It has to be stabilized. My shoulder has to be down. So now one point is fixed, and then if I stretch it, I get good stretch. Okay, the QL stretch. You can do it on the door where you can hold the door feet together and you can pull it. But if you turn, you're not stretching UL, you're stretching different muscles, okay? So you want to make sure you don't compensate, because anytime you're trying to stretch any muscles, you want to make sure that the whole rest of the body is stabilized. Then only you're going to have a good effect of stretch. The second mistake is overstretching. Everybody has a different tolerance. But as I mentioned about the stretch reflex, if you overstretch, you're pulling the muscle fibers. There are chances that if you overstretch, you may injure some of the muscle fibers, okay? So you have to be careful, you need to know. So normally, the way you can tell is when you stretch your muscles and you feel the tightness, right from that moment, just push a little bit more. And every time you're trying to go a little further. Under stretch, as I said, everybody's tolerance is different, okay? So if you're tight and your tolerance to the pain or stretch is not good, you won't stretch enough to see the results, okay? So that's why the perfect amount of stretching is very important. Now, some of the don'ts for the stretching. So don't stretch cold. It's better that your body is a little bit warm before you stretch. You can start with the 10-second stretch, okay, before you go with the 2-minute stretch or 1 minute, 60-second stretch. Because when your body is cold and you're trying to stretch for 60 seconds, it's like, your muscle is rigid and you're trying to pull and it's just gonna break some fibers, okay? So warm your body, or you can just do 10-second stretching first before you go with the 60-second, okay? Don't stretch to the point of the pain. Pain is an indicator to stop, okay? The pain is like a fever. Fever means there is something wrong to your body. Some infection is going on. So fever is simply a symptom tells you that something is wrong. Same way, pain is a symptoms or indicator that something is wrong. Maybe your muscles are not functioning well, your joint is not moving well, or it's just the indication. Don't bounce while you stretch. There are different types of stretching that you have to learn, like a ballistic stretching, but we try not to, like when you're doing a long stretch, you try not to move, because as I said, the rest of the part has to be stable. You just stretch whatever you're trying to stretch, not the other part of the body, okay? Don't stretch an injured body part without consultation from the professional. This can be very severe. Like if you have a back pain, this I see a lot actually. I hear a lot. I was following yoga, I was following stretching from the YouTube, Google, or some different, like, course and some other platform, and they don't know exactly, like, about your history. And then you think, okay, you're doing yoga or stretch, and then you're not supposed to do that particular stretch that may injure your back or knee or shoulder or upper back, or you do it, and then you end up with the more pain. Because when your back is vulnerable, when your alignment is not right, and you particularly use that muscle to do overstretching, or like, you pull that muscle, that can cause a problem. That can increase your back pain or neck pain. I must say, like, some of you might have experienced in the past where you were doing something good, like stretching or regular exercise, and it just flares up the pain. So you need to know exactly which is the right thing to do. All right, now I'm going to explain about the stretching, the self-stretching, because I wanted to push this part faster so I can demo all the stretching. So let's do it together. If you guys are ready, okay, do it with me. I'll not try to hold it longer time. It is advisable that you hold for a long time, but because of the time, I'm gonna make sure we just, like, do it maybe 5 to 10 seconds. But when you do it, you want to do at least 30 seconds. Okay. All right. I'm gonna call Amalia and let's start doing it. All right. Thank you, Amalia. So we're gonna start with the desk stretching. So think about this is your chair. Okay. So you're sitting in the chair. You're on the computer. You're working, and then during the daytime, you're taking a break in ideal situation, and you're doing a stretching. Okay. So first thing we're gonna do is a side bending that does address your upper trapezius. So the side bending, you just go on the sideway. So when she is using the hand, that's a passive stretching. But you got to make sure you hold the chair so the shoulder is down, it dropped, so you can get the good stretch. And as I said, like you can use your hand and you push a little bit more so you get that passive stretching right around here. Okay, you hold it, as I said, about 25 to 30 seconds. In the office, I don't want to hold you like, at least for 1 to 2 minutes, but at least you can do 25 to 30 seconds. That can relax your muscles. Okay, all right. The second one is forward bend. Okay, so I'm trying to address the levator scapula, which is one of the muscle in your neck. So again, you keep your shoulder down, you turn your head left, and you look down, forward. You can use your hand to push it down. You're gonna feel the pull right around here. Okay, so that's the forward bend, like especially for the levator scapula. The next one is for scalene, which is again the small muscle in your neck. This muscles, this levator scapula, scalene can really help you to take the pressure up from your neck. Sometimes even it helps you to reduce the headache, because if your headache is musculogenic, your tightness, you're building a stress around your neck, this can really help. Okay, so for the scalene, what you do is you drop the shoulder down, you turn, and then you look up. Okay, so you're turning and you're kind of looking backward and upward, so that stretches your scalene. Okay, all right. So other one we're gonna do is a rhomboid. So if you're sitting in the chair, okay, you can do this in a sitting, but just for video purpose, I'm gonna make her stand up so you can see what we're gonna do. Okay, so when you do the rhomboid, which is the muscle in between the scapula, so you hold your hands, you grasp your hands, and you pull it forward. So your shoulders going forward. So you see this one, relax. So upper back is moving. Okay, good. Do it again. And you hold it and relax. Okay, that's for the rhomboids. Okay, so sit again. Now we're gonna do the trunk rotation. Okay, so if you're in a chair, you can hold the chair. Okay, here we're just gonna pretend, and then you can turn, you can pull. So if it's a chair, we're gonna pull like this with the handle, and then you get the stretch on your trunk. Okay, do on the both side. Okay, all right, and side bending. So right in the sitting. Okay, we're gonna go on the sideway. Again, don't go forward. It has to be neutral. We're just showing you because of this limitation here. So just go sideways. You're stretching your back, especially QL, and you come back. Okay. Now we're gonna do the pectoralis stretching, your upper, like right around here. So you can hold your hands and you just pull it out. Okay. So this one, you're just your shoulders. You pull as much as you can. You're going back, 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 back. You should feel the stretch on your pectoralis in your chest. Okay, and then we're gonna do a hamstring stretch as well. Okay, so in sitting, just kick your leg straight up, and you're just trying to touch your toe. Okay, as we know, her hamstrings are tight, so she can't touch the toe. Okay, all right. So these are the desk stretch. Okay, now if you do this, if you're a desk job, if you just do this one time, the whole stretching a day, that can really make a big difference. It literally will take maybe 10 minutes, okay? Or you can break it down. You don't need to get 10 minutes. You can spend maybe 5 minutes and 5 minutes. Break it down and do it, but at least you do it once, okay? So that can really prevent the injury, helps you with your stress, helps you with the posture. It keeps maintaining a good posture. So that all really helps you on a daily basis. Consistency is the key. Now, full body stretch. So all the stretching we did, you can definitely include that. And then I'm gonna include some of the basic muscles that are responsible for the back pain, leg pain, knee pain. So we're gonna do those muscles now, okay? All right, so let's start with a piriformis muscle, which is a small muscle attaching from your sacrum to your hip, okay? And that muscle is responsible for your radiating pain sometimes. So if your sciatic nerve is passing through that muscle. So sometimes if you have a tight piriformis muscle, it can mimic the symptoms of the sciatica. So your back is fine, but because that muscle is tight, you can have the same symptoms like a sciatica. So to stretch your hamstring, so you put your one leg down, okay, and then we're gonna pull it this way, okay, like this on the other side. Yep, piriformis. Okay, so you're stretching those area, you pull this way, and you hold it. Again, the holding is at least 30 seconds. Okay, so that's for piriformis. Now let's work on your glute medius. So here we're going to do the figure of 4. Okay, so your leg is down like this, so straight. So don't try to keep it like this. Try to keep it more straight like this, and then you lift it up and you pull it. So you're right now you're working around the gluteal medius. Okay, and down. The third one is the butterfly stretch. This is also one of the yoga pose that you must have seen. But you hold the position, trying to pull down. If you can reach around your thigh, push it down. The more you do it, better it is. Okay. And the other one is knee to the chest. Very easy one. Put your both legs, like other leg down, and then make sure your knee goes to the chest. Okay. If you're having a back issue, you can keep here. You can keep knee a little bit bent, so that flattens your back. It does not have the same effect, but it does do the work if you have a back pain. Okay. All right. Now we're gonna do the spinal twist. Okay. So the spinal twist is there are 2-3 different variations in the spinal twist, but I like this the best because you really get a good stretch. So you do the figure of 4, okay, and then you turn all the way on the other side, and making sure, if you notice, the shoulder is down. Okay, because if you lift your shoulder up, you're compensating. Okay, and back, and same thing you can do on the other side. All right, and back. Now we're gonna stretch your quads. Okay, so for that we're gonna do face down. Again, there is a variation. If somebody has a stenosis, I do not recommend to go face down. Then you want to, if you're doing this, you got to keep the pillow under the hip. Okay, or you can do in sideline. There are different ways of stretching your muscles. But here in the prone, face down, bend your knee, and you just do that. You can use your hand if you can reach it and pull it, or you can use a strap, the stretch bend, and you can pull it as well. Okay, and now we're gonna do some standing stretching. So I'm gonna explain sumo stretch and a wide leg stretch. Okay, all right, thank you, Maria. So for this, I'm gonna make the screen a little bit down so you can see it. Okay, so here, okay, so you can see my leg. So I'm toeing out, both legs is out, okay, and then my legs are not like this. I'm trying to keep it out, okay, and down like this. My back is straight, okay, so my back is straight. I'm not arching. I'm keeping it straight, okay. My legs are out, and I'm going down as much as I can and hold the position, okay. Now, the last one is a wide leg stretch. So you keep your legs like this, okay, and you just stretch forward. Okay, hold it and come back. Okay, so that's the self-stretching. All right. Now, after this, as we're on the screen, let me explain the passive stretching. You've seen a lot of centers out there, Stretch Lab, and there are different types. But the reason, like, that the passive stretching is important is because you can put quite a bit of pressure on it, okay? So let me show you some of the passive stretching. All right, Amalia, let's do this passive stretching. So we're gonna do the QL, which is your back, especially your stiffness. This helps a lot, okay? Okay, we can hold this. We use this belt to stabilize the pelvis. Okay, and then once I stabilize it, I'm gonna hold her hand, hold her legs, and pull, pull, pull. Now we're making sure, okay, I'm gonna show you on the other side. So I'm gonna making sure the pelvic is down, the belt is really stabilizing her pelvic, and we're stretching all this area. Okay, so that's one. If I wanted to stretch, okay. Now I'm stabilizing her one leg. So now this leg, I can do gluteal medius. I'm going this, and then making sure hands on the side. And then, so now as you can see, when we know her hamstrings are tight, okay, there are some of the tightness she has, but now as you can see, this leg is not coming up. We're stabilizing it. She wants to come up, that leg wants to come up, but we stabilize, so that helps. So then you get really good stretch, okay? Same thing like, with the piriformis, when you do that, this leg stabilize really helps with that. Now let me show you one stretch about the PNF. So we did explain about the PNF, proprioception neuromuscular facilitation. So that, what we're gonna do is, I'm gonna do hamstring. So just to give you a demo, because we know her hamstrings are tight, and let's see. So as we know, okay, lift it up, let's check. Now, do this leg straighten up, so you know how much tightness we have, right? Now let's do the work. Okay, put your legs down. Okay, I'm gonna stretch it. So I'll make sure the knees are stable. Okay, the other leg is also stable, and I'm gonna stretch. And now I feel the stretching already. So from here, once I feel it, I'm gonna hold it. But now, okay, push your leg on my shoulder. Yep, so she's pushing it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, now I'm gonna try to go a little bit more because we got some new range. So I'm gonna go more. Now push it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, now newly gained range, and then push it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. Okay, let's check it out. Lift your legs up. Straighten up this one. Okay, now keep it 90 degrees. Straighten up. Straighten up the other one. You can see the difference. This leg, okay, staying a little bit left. Okay, do it again. Push it. So you can see the heel on this leg, the left, right one, versus the left one. You can see it's a little bit better. Okay. All right. Thank you, Maria. So that's the difference between the active and passive stretching. Let's get to my slide. As I said, I tend to go over. I know it's already 6:40, so I'll get back to the QA. But let me share my screen so we can make sure we covered everything. All right, so we did go over all those things. All right. So yeah, we did explain everything. So as usual, I always like to do some giveaways at the end of the session. Thank you all for your time. And then here, whoever signed up for the session, they will get the recording of this one. So even though they did not attend this one, but they will still get a copy. A lot of people sign up, but I understand people have issue with the time, but we'll send the recording to them. But people who attended today, they will get some good discounts and all. So self-stretching series for desk stretching, short and long version, I will assign it, specifically design the program for you, and I'll send you the copy. So that will have each, like when I say short and long version, short means if you're on the job, you can do it. Long version means if you're home and you want to work on it. So I'm going to explain both of them. So I'll in detail, I'm going to customize the program, and whoever wants that program, just call us by Friday, because everything is only till Friday. Call or text or email. Okay, our phone number is 469-212-8888. Our you can text on that number, or our email is info@surecurewellness.com. Okay, But yeah, call by end of the Friday, then you can qualify for that. You will also get free 15-minute muscle length assessment. Just the way I show you some of the assessment, like few muscles, we can do a lot of muscles assessment just to find out what is the main area of concern, which muscle is limiting your ability to move around. So we can do the whole assessment, the muscle length assessment. So we're gonna give you 15-minute consultation. We're gonna check your muscle length. If you have any tightness, I'm gonna address those things, and I'm gonna customize program for you as well. Okay. Now, also, we're creating the members area for stretching. So I'm going to include all the stretching, like back pain prevention, neck pain prevention, postural resets, desk stretching, pre and post workout stretching, and many more, like stretching for the sleep, relaxation stretching, for headaches. I'm going to include a lot of things, and over the time, we're going to keep on adding. So that section is only for the members. So typically, we're going to start membership around maybe $100, but today, if you call by Friday, you will get the access in $49. We're gonna start with few stretching sessions, but we're gonna keep on adding in that members area, so you can get that access lifetime. It will take probably 1 or 2 weeks to set up everything. So once you give us a call by tomorrow, we can give you access probably in 1 or 2 weeks. Okay. So if you're interested to get access to all the stretches possible for every diagnosis or preventative care, or just a routine full body stretch, you will have the access. So you can go back anytime you want for the reference. I'll explain some of the tips as well in that course as well. Okay. And also we do the passive stretching. If you live close by, if you wanted to do the full body passive stretching, just I explained with the belt and everything, or we use the cupping as well. So if you're interested, we're giving 50% off on the regular sessions. Give us a call by Friday and redeem your gifts. Okay. All right. So that's it for my presentation. Now let me see if you have any questions or concern or anything, just let me know. Okay. Everybody's good? All right. And if you want to, yeah, thank you so much for attending. And yeah, if you have any question, you can unmute and you can talk to me. You can ask me any question. But if I did a good job and you understood all the session, stretching and everything, then great. Okay. But don't forget your a free 15-minute assessment, because you can learn a lot about your own body. Because sometimes all you need is, I always tell people that it's easy to Google so many things, but my job is to tell you one thing, that okay, you need this. Like if you search, I need to stretch my pectoralis, there are thousands of videos for stretching, but I need to let you know that okay, stretch your pectoralis. Okay. So thank you so much for coming, and if you don't have any question, I will see you all. Let me just double check. Yep. So Miss Reed is saying thank you so much. I'm still on the floor stretching. All right, you're still stretching. Yeah, I'm sorry. I had to kind of rush a little bit because I know the time is limited. Because if I start doing the 30-second hold, the session will last longer, and we don't want that. So, but thank you so much for all participation, and we will send you this recording for sure. But don't forget to call us before Friday. Okay, all those things I explained are valid till Friday. All right, thank you so much, guys. Have a good night. I'll see you next month, Wednesday, third Wednesday, 6 p.m. If you have any suggestion for any topic, do let me know. I'll try to cover it. Next time, we're thinking that probably we're gonna cover postural correction, but we'll let you know. So, all right. Thank you. Bye.